It's a big day in health and social care. It's the day all health and social care facilities in Northern Ireland go smoke free. And today we're here in front of the Cancer Centre in the Belfast Trust, launching the 1 month to go before we go smoke free. It's a very symbolic day. Here we are outside, as I say, the Cancer Centre. We know that 1 in 3 of all cancer deaths in Northern Ireland are as a consequence of cigarette smoke. We know that 17,000 admissions a year to our hospitals are directly as a consequence of cigarette use, and it costs the health service £164 million every year. And that's aside from the 2,300 deaths every year. So this is about the health service standing together, demonstrating leadership, providing support for those who work in the health service who smoke, and also those who use our hospital facilities. Gone will be the walking through plumes of smoke before you walk into a healthcare facility, and it's excellent that we're now, as a healthcare family, taking the example of the Western Trust, which went completely smoke-free back in March of 2014.
Within Northern Ireland there's a tobacco strategy, and the aim of the strategy is to move towards a long-term population free of smoke. In the meantime, one of the key aims within it is to protect people from the impact of smoke. This initiative today is really one of the steps in that we will change the culture within health and social care grounds, that there is no smoking on the grounds, and that will encourage and support the cultural change of the non-acceptability of smoke in public places. The big emphasis is on protecting people from second-hand smoke. We're standing outside the Cancer Centre, and I think there's probably nothing worse that I could imagine than going in for treatment in the Cancer Centre and having to walk through smoky people standing at doorways smoking. And this will ensure that doesn't happen. But it also will help smokers in terms of encouraging them, supporting them to stop smoking. Because within the hospital, if there are patients coming who are smokers, we will be providing nicotine replacement therapy and support to stop smoking. So it's really going from both angles.
Smoking is the biggest cause of premature ill health and death in Northern Ireland, so there's no issue that is more important for us to actually do something about. And while we've had a lot of progress over a number of years, it still remains the biggest killer and the one we really can change and do something about.
It's, the introduction of the smoke-free legislation in 2007 was a huge success. We've seen a reduction in the percentage of the population that smokes from 24% down to 22%, but we've still much more work to do. I mean, and it's completely incongruous that in a health system that's designed to treat and keep people well should be facilitating or indeed giving tacit support to people engaging in risk-taking behaviour such as cigarette smoking. Now, we recognise that it's addictive habit. We recognise that it's life-limiting, but we need to be doing more to support people kick the habit, and that's why it's an important message that we're sending out. I mean, this is a further step in society's attitude to smoking. We take it for granted now that when we go into a restaurant or we go out socially that we're not going to be exposed to other people's second-hand smoke. That wasn't the case when I was growing up. And there are real health benefits for that. We've also seen the Minister announcing his intent to see cars and vehicles carrying children being smoke-free. So again, this is another step on the way to achieving a smoke-free society, and that we reduce the harm, the costs, the deaths, the disease caused by what is a life-limiting addictive habit.
Not only they're removing a smoking shelter, but they're also replacing it with a cycle shelter. And in many ways that symbolises that removing smoking, which is one of the worst things we can do, and replacing it with physical activity, which is one of the best things that we can do for our health. So it's very important that we're seeing both sides of this, not just telling people to stop smoking. And that message is getting through, and people know the difficulties of smoking, but we also want to give them the encouragement to take up healthier activities to lead to a healthier population and a healthier community.
E-cigarettes are currently banned in healthcare facilities in the same areas that smoking cigarettes is banned, and the introduction of this approach from the 9th of March will also ban e-cigarettes for being used on trust premise as well. And as I say, we'll be working to support staff and support those using our services in health trusts and other facilities, but also those visiting those facilities in kicking the habit and supporting them and providing patients with alternatives when they're in hospital. Now, we're not breaking new territory here. Health facilities in the Republic of Ireland have been smoke-free for a number of years. Many hospitals across the rest of the UK and England are smoke-free. So there's good examples of what works. There's good examples about supporting staff and signposting them into service. And it's excellent that, removing this smoking shelter today, we're actually going to be replacing it with something, Belfast Bikes, which is actually about improving people's physical health and their well-being. And that's a fantastic message to send to our workforce and to the general public.
Well, this is really about not only the staff but also the patients and indeed the visitors, and it's very important the staff are leading by example, but they too need help and they are getting the support as well, because we're encouraging them to use this opportunity as well to help them to stop smoking at the very same time.
There are a whole range of free stop smoking services across Northern Ireland, community pharmacies, GP surgeries, within the hospitals. The best point of contact is the wanttostop.info website, the PHA website, so that's www.wanttostop.info, and that lists all the services that are available free of charge across Northern Ireland.